I don't know if I feel abandoned. I just feel like they just don't care.
Physical and emotional toll of being a nurse, an ER nurse in general, is high. I think I have kind of like a base level of anxiety every day going to work, just because we don't know what's coming. We don't know if it's going to get bad, if we did the proper things to flatten the curve.
Sometimes you don't even want to say that you're a healthcare worker now when you go out, depending, because you feel like you're a leper.
I understand that I went into nursing, so I hear a lot of responses saying you signed up for this, but not really. We signed up to take care of people, but also to take care of our own self.
You know, before all this happened, we had disposable masks that we would wear into isolation rooms, and then we would throw them out before leaving the room.
We only get one of these, and the mask we only get twice a week. So as soon as we come into work, they punch our card saying that they gave us one already that week, and we only get one more a week.
Because I was around with H1N1, but it really wasn't the situation that it is now. We never worried about having enough PPE.
A lot of these PPE guidelines have been in place for decades, and for them to all of a sudden change on a daily basis isn't because that's the right way to do it. It's because they're rationing what we have to work with, and we're not going to get more. So we have to use what we have.
I mean, you might have people that are mildly symptomatic, but the ones who end up getting admitted, it is scary.
Their heart might be racing, they have a temperature, a lot of shortness of breath.
And this isn't just old people. I watched a healthy young male die in front of us. Death is sad. Being a nurse doesn't make it any easier.
We are doing so much to take care of the patients, take care of us, and not bring this home to our families.
On the drive home, I'm alcoholing myself from my arms up, my face, my hair. I come home, I take my stuff, put it into a plastic bag in the garage, and then I go straight in and I take a shower. If it gets to a point where I feel like, I can't stay safe, then I just won't come home.
This virus does spread very fast, and opening up the businesses and those things, we've gotten to a good place where we're flattening the curve, but that doesn't mean you just stop there. You don't get to a point and then just let it just kind of fizzle out, because then we will see a spike again, and that's what we're trying to prevent.
I know a lot of people say it's my right, it's my body, but you also are putting others at risk, and those others are now going to come into the hospital and take up beds for very serious patients that need those beds.
I haven't seen any of our legislators in Wisconsin stand up and demand that we be protected. On the contrary, you have people like Voss throwing in that last minute disclaimer. There's no way that we can prove that we got COVID from a patient.
It gets really frustrating because it's all science-based and people aren't paying attention to the science behind it. We don't have enough information to be able to stop what we see.
I'm not saying that we have to keep things closed for 3 more months, but I do think a few more weeks is reasonable to make sure that things go down, we're able to protect people, and a temporary halt in our liberties for the greater good, in my opinion, is what's necessary.
If you want to protest for more PPE, ask for more testing.
I think of the people of the United States as wonderful people, and I like to think of us as united, and I would love it if we could stick together just a little longer. Just give us a little more time to work together, help halt the spread, save our neighbors, save your family members, and help the healthcare workers so that we don't see a breakdown in our healthcare system.
Healthcare workers want to be out just as much as you do. I do not want to be at home when I'm not working. I want to see my friends. I want to see my family too, but please do not go out and about. You can spread this. You don't know you're spreading it.